Prevention Works is a nonprofit. We do substance use prevention and interventions, violence prevention and intervention. We also do family reunification programs, social emotional learning for young people, and in-school and out-of-school services. At the state level, we receive substance abuse block grant dollars for both treatment and prevention. And if that is reduced, it will be a huge reduction in the services for young people and families for substance abuse services and some substance abuse disorders. But it's also tied to the federal budget as well. We also receive funding from out-of-school time funding, of where we provide hundreds of hours of out-of-school time programming for youth and families after school and safe places for them to go and to learn skills and substance abuse and violence prevention skills. It is life-altering. Just to give you perspective, from our last fiscal year or like calendar year budget to this, we've almost had double the amount of requests, and we have everybody on a wait list. So in one of our programs, Prime for Life, which is a substance use intervention, we have a 250% increase in participants in that program for this year. So if that budget is cut, that will no longer be increased, and we'll be experiencing an extreme reduction in that intervention for alcohol and marijuana and among people that have already begun to start using. The majority of our services are really prevention and early intervention. So the average age of onset of substance use right now is 10. So when you think about that, getting to our young people early, both in school and out of school, and preventing addiction and violence before it even happens. So when you think about your own children and your neighbors and your community members that are 10 years old, without these services, the age of onset of use and violence will be earlier and earlier. And so we'll start to see a huge crisis in substance use and violence in our community. I would say contact your representatives, contact community members that can also leverage resources and relationships, text, call, let your representatives know how important these services are, and without it, we will have a major crisis in our communities.